Doxophilin is a novaphilin that has 3 actions of relevance for the treatment of asthma and COPD. In healthy lungs, we breathe in air that enters the bronchial tree for gas exchange in the alveolar region. In healthy lungs, when you look inside blood vessels, both red blood cells and white cells circulate freely and do not attach to the vascular endothelium lining the blood vessel wall. In patients with asthma, when they breathe in irritants or cold air, this can trigger the contraction of airway smooth muscles surrounding the airways, leading to bronchoconstriction and wheezing. In patients with asthma and COPD, when we look inside blood vessels, we see white cells expressing sticky molecules on their surface that allow these cells to leave the blood vessels and enter the surrounding lung tissues. This in turn can trigger further bronchospasm in conducting airways. When a patient takes a tablet of doxophilin, this can enter the gastrointestinal tract and enter the blood to go to the lung and cause relaxation of airway smooth muscle and bronchodilation. Furthermore, doxophilin can inhibit the activation of white cells, preventing their emigration into surrounding lung tissue. At King's College London, we have been examining the anti-inflammatory effects of doxophilin using a technique called intravital microscopy. This video shows a healthy blood vessel where no cells are attached to the blood vessel wall. Following administration of an irritant such as lipopolysaccharide found in tobacco smoke, this leads to the activation of white cells, which shown here in the video clip in green, and the emigration into lung tissues. After doxophilin, the white cells are inhibited and so fewer emigrate into lung tissues, which leads to a reduction in bronchospasm. This evidence confirms that Puroxan has significant anti-inflammatory effects that help explain the clinical effectiveness of this drug. The anti-inflammatory effect of Puroxan when used regularly leads to a reduction of symptoms such as bronchospasm. Doxophilin has 3 benefits: fast onset of bronchodilation, proven anti-inflammatory effects, and prevention of bronchospasm. There are other additional benefits of doxophilin, such as having a wider therapeutic window than theophylline, a convenient oral administration of tablet or syrup, and the reduction of the number of asthma attacks. Doxophilin also reduces the use of rescue medication, such as short-acting beta agonists, and due to its neutral pH, it has good gastrointestinal tolerability, is safe in cardiac patients with the incidence of palpitations and arrhythmias being rare, and finally, it can be co-prescribed with anti-leukotrienes. As a syrup, Puroxan is convenient to administer to children with asthma. For adults, Puroxan is conveniently administered as 1 tablet twice daily.